I got a little space in between my gum line and the prosthetic, and I thought, did I really go to the right place?
Whenever the little gap did appear, was the air. You would talk, like all of a sudden you'd feel like air come through and you're like, is this normal?
And we both got these, and yours looks great, by the way.
Thank you.
We learned about something that was very concerning. I think we need to have a discussion about that and how we dealt with it to help others.
We're also going to answer some questions that you have directly asked us about the cost, maintenance, and the overall feel of the dental implants.
Whenever I first got my prosthesis, everything started to change in my mouth and the swelling was going down and stuff. I noticed that I had a small gap that appeared. And I had a little bit of concerns about how it was going to affect the integrity of the prosthesis itself, food, how to clean it, things like that. Did you have the same kind of thought process?
I noticed that food was getting trapped. But, I did have a gap, but not so much. My gum line, it didn't necessarily recede. It actually grew. So I had a different challenge that I was dealing with. However, I did notice that food particles were getting stuck. But I was really concerned at first, especially because I actually was a little afraid to eat,
right?
Because I didn't want to mess up anything that was going on in there. I knew they had just pulled my teeth,
right?
And I didn't want like something to get in there that I couldn't get out. So I was like, okay, maybe I'll just eat like something smooth that I can just kind of swish with. But I got used to it. Because once I was released to use the water pick, I started realizing that everything was coming out, even things I didn't even remember that I ate. I think probably the other thing that I noticed whenever the little gap did appear was the air, right?
Oh, yes.
Like whenever you would talk, like all of a sudden you'd feel like air come through and you're like, at first I was wondering, is this normal? Wait a minute. I didn't feel that before.
Cool thing is, like, I can use this as an example. Like, you have your titanium bridge and stuff, and then your prosthesis goes up on the implants. Well, where your gum would set on it, as your gum's going to be swollen, well, as it heals, because the swelling's going to go down. They just pulled out all your teeth.
Right,
your body's going
right.
to be affected. As it goes down, it's going to be kind of like that, a little space. Well, you're worried.
Right.
Because you don't know. You're not a doctor. You're not a dentist. So that's why it's really important that, how our questions were answered, I felt.
Yeah.
So it made it feel like there wasn't really anything I had to worry about. There was just, I had to figure out solutions of how to deal with this.
Yeah.
So,
yep.
And as we've spoken before, I went to many different places where I was going to have to come back, wear something like this for months and months and months. And whenever my mouth started to change and I got a little space in between my gum line and the prosthetic, I wasn't really for sure what to do. And I thought, did I really go to the right place? Because of all the anxiety I had from all the other places.
Right.
So.
Right. I understand.
The thing that I discovered, because I had lots of questions, as I'm sure you did,
right?
And everybody else that has this done, and as you're having an extensive surgery like that, things swell. Whether it's your arm or whether it has to do with your mouth, so the gums will swell up and stuff, and then as you start to heal and your mouth starts to change, that's whenever the gap, the space, kind of developed.
Right.
So I didn't, like you probably didn't know. You didn't know what to do.
Right.
So what actually did you do to find a solution to this or answers?
Well, I called Nuvia.
Picked up the phone.
I just picked up the phone.
You're
and I
telling
called
me
them.
you just picked up the phone.
Well, anytime. I mean, even when I wanted ice cream and I didn't have that on my list of the things I could eat, I called Nuvia because I wanted ice cream.
They gave you their number.
They did.
And you picked it up and dialed it, and they answered.
I was like, can I have ice cream?
And they answered your questions?
And they answered my question.
You got to be kidding me.
Well, they would.
That's crazy. So you're telling me
of course,
you picked up the phone.
Yep.
And you called them.
I just called them.
And you asked about
Yeah, I
Your
just said,
mouth?
well, because things were changing, right?
Oh, yeah.
And so you're really worried, like you just want everything to go so right,
And nervous?
and nervous. I wanted to make sure I wasn't the problem, right? Because am I brushing too hard? Did I spit too hard? Like
Yes.
what's going on, right? So I just picked up the phone and was like, "Hey, I'm noticing like
And
some
they
changes."
answered?
They answered, and go in. And basically, just explain to them, that I was kind of what I was experiencing.
Your fears.
Yeah, my
Doubts.
fears, my,
Yes.
my mini anxieties that I
Oh,
probably didn't
yes,
need to
yes,
have. But
We all know how that feels, right?
they calmed them down. No, they
Yes.
calmed them down. And basically, they just said, it's part of the healing process. Your body is going to change. Things are going to be shifting around during this time. It takes, time, and everybody is different. Right? Everybody experiences different things. So I've heard people on the Smile Maker Club even talk about how it starts to feel really tight, like 3 to 5 days after, they're like, oh my gosh, it feels really tight in there. And again, it's all a part of the healing process.
And did it cost you anything?
Not a thing.
Holy smoke.
Not a thing.
That's amazing.
I know.
I love hearing that,
I know.
because that's not the everyday
Yeah, you're so right.
in this industry.
That is one thing about Nuvia, like they're always there to answer your questions, no matter big or small.
At no additional fees.
At no additional fee.
Wow.
Yep.
And there's somebody on the other end of the line.
There is a live person.
A live person. So that's awesome.
No. Yeah.
So once you got somebody on the phone, what was your questions with them?
Well, I asked them if, if what I was experiencing was normal, and they just asked me to explain, what is it exactly that's going on? And I said, well, I have a little bit of tenderness and I'm feeling like a little bit of air bubbles and I just don't know. I want to just make sure. They're like, well, you know what? Ease your mind. Come on in. I go in and they talk me through, they tell me, okay, they look it all over and they're like, yeah, seems like you're healing fine, And I said, okay, well, are you going to be able to fix this? And they're like,
what did they say? I got to know.
Of course they said no.
Did they say no? Oh my gosh.
I'm just joking. Of course they fixed it.
Let me see.
You can't even see anything.
I can't even see. Holy smoke. That looks great.
I know. No gap to talk about.
So they made
now.
adjustments and stuff. When the adjustments need to be made?
Well, they wanted to make sure that the gums were fully healed.
That's important.
It is. So they didn't want to do it too soon.
Correct.
And so after the healing period, you have your 4-month appointment.
At the 4-month, right?
And that's exactly when they go in. They want to make sure everything is going well. And then at that time is when they will make the adjustments.
And I read somewhere the mouth heals very quickly and stuff. But you have where the gums, as they're healing and they go down and stuff. And then you also have your actual implants up in your bone. And that might be another reason why they wait 4 months, because they want to make sure that bone adheres to that implant very solid, so that you don't have any problems in the future.
Right.
So not only did they fix that, they explained everything else to you to give you peace of mind. So you had tons of peace of mind, and they fixed whatever issue that you felt like that needed to be handled.
Yeah, exactly. I think more than anything, they managed my expectations.
They
Right?
Oh, wow.
What did I know what to expect? Right?
Never. We don't.
We don't know what to
because
expect.
nobody tells you.
So once they explained it, then it was like, oh, okay. And then once I knew that at the 4-month mark, it will all be taken care of, I had no challenges.
So, you went in and they were addressing your concerns and stuff, and they just didn't brush you off because they didn't have time for you. They actually made time for you, correct? Which made you feel important.
It made me feel important.
Yes.
Yes.
So did you also get that feeling of comfort whenever you realize that not only is this what Nuvia does every day, one thing they do every day, but that they just don't try to have one person do every job. They have a whole team of not just the doctor, not just the surgeon, not just the anesthesiologist. They also have many surgical techs and assistants that are there to make sure that you feel comfortable about what's fixing to happen.
Yeah, absolutely.
I thought that was a big deal too.
Yep.
So we got the gap taken care of.
Gap,
Okay.
no problem.
No problem.
No problem.
And it wasn't like the San Andreas fault.
Right,
You know,
right.
that big old
Exactly.
Okay. So, and we got the gap closed up
Yes.
with how it should be
Absolutely.
as your mouth healed.
Yep.
Which you're still going to have one, and you got to clean in there and stuff.
Yes.
So, but it's in the big scheme of things, it's a small little thing for a great solution to your dental problems.
Yes.
That's how I felt too. But we still get that one question.
I know.
What's that question?
How much does it cost?
How much does it cost? And once again, they provided us this great, fantastic dental implant pricing guide, which you will find in the link below. What do they have to do?
All you have to do is click on it.
Click it. That's it. That easy, that simple. So the gap's no big deal,
No big deal.
and neither is this.
Yep.
So click it. Right?
That's all you gotta do. Click
it. Now we're going to answer some more of your questions that we get all the time. So some of the questions that we've gotten off of our Smile Makers page, Angela said, I am very close to making a decision regarding implants. Tell me a few things such as how does brushing work, flossing, the best way to keep them white. Is there maintenance?
So let's see. Brushing.
Mhm.
Just like you brush normal teeth, right? Extra soft toothbrush would be great, but just brush it regularly. Make sure that you get appropriate toothpaste.
Which they will give you.
They will give you, I know. There's many different types that you could get. Just make sure you don't get whitening. That's a big one. Make sure it's non-abrasive. That's good. I think everybody has their favorite, but Sensodyne seems to be one that people are referred with all the time.
And when I say that they will give you, they're probably not going to give you the toothpaste, but they're going to give you.
They will give you a list.
Yeah, a list.
They'll give you a list,
yes.
right? So you don't worry. And then, like I said, just like you're brushing your natural teeth, Flossing, I'll tell you this, okay? Flossing seems to be one of those, either you get it or you don't, right?
What about the water pick?
That's the best.
Is it?
That is the best.
Awesome.
Oh my God. But you know what?
And they make a travel one that you
They
take
have
with
a travel one. They have the stationary one.
Fantastic.
They have the travel one. I love to have both, right? But I know you, sir. You've got a special kind of water pick action going on.
Yes. And if you are on the Smile Maker page, there's videos on there of how I use my high impact water pick, which is
in the shower.
My shower head. So if you have a shower and you turn to that little deal and it sprays pretty hard. And trust me, don't do this until after your 4-month appointment. So it sprays pretty hard. Well, you get in there and you lift up your gum and you take it and and it cleans it. It'll get in there. And like I've told people before, it baptizes your mouth. Me being from Texas, baptism is pretty important. So
yes,
whenever I'm done with that, it's probably the cleanest my mouth's ever been.
I think I'm going to start calling you Ricky the Baptist.
Something. So, and on yours, if you're just using the regular water pick, there's not really anything to fear.
No, not at all. I know that you're probably going to spray everybody and everywhere. So one trick
and
that I
mirror.
did. The mirror is the mirror's going to get attacked. But I always tell people,
it's
like, if you're trying to learn, get the portable one and do it in the shower, right? Because you're already getting wet in there.
But I already got your portable one that's on the wall.
One, but if before 4 months,
okay,
stay with us. No.
And is there settings? Is there settings on the water pick?
It's good to have one that has settings, right?
And you want to use
the lowest setting,
the lower setting.
Yes, make sure.
And then as you get more comfortable, you
can crank it up,
turn it up to where you feel like it might need.
Yes,
okay, to make sure that you're cleaning everything.
Absolutely,
because just like dental maintenance was important before, it's still very important with these.
It's very important.
Correct.
Like, just because you have dental implants, you still have to clean them. And that is most important. And you just treat them just like normal teeth. I think there was something about how to keep them white. Did they ask that?
Well, people talk about wine and
Right.
coffee and things.
Right.
That's a big question that we get.
Right.
And the wine and coffee, I drink a lot of coffee. I'm not a wine drinker myself, but I've had no issues with discoloration or of course, no sensitivity,
Right.
which is fantastic. So the toothbrush with the Sensodyne, if that's the one that you should choose, is basically used to polish, I feel.
Right.
You know, and if you don't think that you can still get plaque buildup on your prosthesis, on your implants, you can actually still get plaque buildup on them. And that's why it's very important to brush just like normal.
Yes.
You know, every day.
Yes. And floss, either with floss or the water flosser.
Or the water flosser.
Okay.
So
yes. And also I'm going to just tell them on YouTube, there is a video that Nuvia has put out about will the dental implant stain.
Correct.
So I want them to go find that.
Oh, that's
a really good
So
video.
Go to the YouTube and go to the Nuvia site, and it's right there with a ton of other videos, such as what to eat, what to expect. There's meal prep videos, things like that.
Yep.
So, and it's right there on the YouTube channel.
Yes.
And like I said, super easy to maintain. You just got to maintain them. And what we're here to doing is we're making it easy so that you have no questions about maintaining those beautiful teeth that you're going to get. So we have another question.
Okay.
There's lots of questions.
I know.
We're going to answer
Let's see
a
what
few
this
today,
one is.
though.
All right.
So Randy from the
Okay.
Smile Makers page. If y'all don't know Randy.
Hi, Randy.
Yeah. So Randy from the Smile Makers Club page, he says, hello.
Hey.
That's always positive. I'm considering having a lower implant done, but my only concern is how does the implant feel in my mouth? Does it feel like a foreign object or does it feel natural? Are there any issues with the seam between the implant and the gum, which we have discussed?
We just talked about that.
Yes, we've discussed that already. All of my upper teeth are crowns and they have never felt foreign.
Oh, well,
So-
that's good.
So what do you, I mean, you've had this done.
Yeah.
Okay.
Yeah.
And you have your upper
My upper's
part done.
done.
Yes.
Mhm.
Does it feel foreign to you?
Well, I will tell you this. At the beginning, there is an adjustment period, right? Because there's something in there that is unnatural, right?
Correct.
They're not your natural teeth. So, and before your teeth, well, my teeth, I can only speak for my teeth. My teeth were not straight. They were all over, right? And so these teeth, they're placed, they're different. And so your tongue is going to go crazy trying to figure out what is this new thing in here, but also your mind
Your brain, yes.
is like trying to figure out what is going on inside of this mouth of yours, right? So I would say at the beginning, there is an adjustment period because you just have to accept them as yours. They are yours. And then, of course, there is a period of where you're trying to learn to eat with them and trying to speak with them, right? But once you get past that, they're mine.
And, you know, and the thing that I found out is it's not an instant gratification kind of experience.
Mhm.
You know, your brain has to say, hey, these are supposed to be here.
Right.
You know, and you're going to have a lot of different reactions that your brain is saying, hey, there's something foreign in my mouth.
Right.
So you're asking, do they feel foreign? Your brain is what's making you think they're foreign.
Yeah.
Because it doesn't recognize it.
Right.
So it creates more saliva. Your tongue's doing different things because it knows that it's foreign.
Right.
Is it going to be like the teeth that you had when you were 10?
Right.
You know, and you were smiling for that school picture?
Mm-hmm.
And we've all seen those pictures. We wore horrible clothes and we had that smile and our mama didn't brush our hair that day.
No, she did, but you messed it up at
Probably.
recess.
It's not, and we weren't color coordinated at all. But we had that smile going on.
Yeah.
Are they going to be like that? They're not going to be like what you had when you were 10. But the reason that you're going in is because they're going to be a lot better than what you had at whatever age you decided that you needed some dental stuff done.
Yep.
So
Absolutely. But after a while, it's no, you don't even think about it.
you don't
right?
even think about it. I don't think about it. It's been, how long has yours been?
It will be 2 years.
Congratulations.
Yes.
Awesome.
Next month.
Next month. Awesome. I'm at 693 days today.
Nice.
And honestly, I don't ever even think about that I have implants in because everything is so, as y'all can see, very small, very small. So they don't really affect your palate or anything not like this thing.
Right.
Okay.
Right.
I don't even think about it. There are some times where, okay, I have to do things a little bit differently, but it doesn't affect anything that I do. It doesn't hamper my lifestyle, or it actually increases my lifestyle.
Yeah.
Our last question is from Sandy. Sandy says she's scared. She's scared that she won't be able to afford this. But she says, we'll see. She's anxious to learn all she can, and she's both scared of the unknown, and she wants an answer.
Yeah. I've been there.
Yes.
I've been there, right? So I think one of the biggest hurdles, there's really two that come to mind. One is first picking up the phone and just asking for help, right? But the second thing is, once I actually do that, am I going to be able to afford it, right? Dental costs are not cheap, and especially when it comes to quality care. What I always like to tell people, and what I would like to tell Sandy, like, don't be afraid, because that first visit will just tell you so much. It will at least open your mind to what needs to happen to get you to your optimal dental health care, right? And so the worst thing that can happen is you walk out with the same thing you walked in with. But the best thing that can happen is you walk in, you find what you need
for free,
right? And you make a plan for a better life for yourself, right? So for me, I was just like you, Sandy. The money scared me. I go in, I find out how much it's going to be, and I think, whew.
Which is different for each person.
It's different for everybody. It's totally different for everybody, right?
And that's why
and
the
my
cost
price
just isn't out there.
My price was my price,
correct,
right? And for me, it was like, okay, what do I need to do to make this happen? Because it was a choice between me doing what I needed to do for a better life for myself, or me keeping that money in my pocket to do something else
that
with.
You're going to spend it on something anyway.
And so what I found out is that I just found money, right? It was all about the B word that I hate to talk about, budget. Why?
Yes.
Why? Right? And so I really just had to create a budget. And
even if you're on a fixed income.
Even if you're on a fixed income. Because you think about, what is it that you're actually spending your money on?
Correct.
When you actually sit down and look at things. And that's exactly what I did with my husband. We sat and we looked at all of the bills. We looked at what was coming in, what was going out. And I found out I was spending way too much money on eating out.
And in any circumstance, what do we not like spending money on?
On
ourselves.
ourselves.
Exactly. Say it louder for the people in the back row for
on
me.
Ourselves.
On ourselves. Correct. We hate spending money on ourselves, so we find any reason
Absolutely.
to dismiss it.
Yeah.
So you can afford it.
Yes.
Sandy, do it for you. Make an investment in yourself if you're watching this video.
Absolutely.
And if they have other questions about price.
Yep. The
right
cost
here,
guide.
The cost guide. Where can they don't have to have this copy, right?
No.
Where can they find this?
They can click the link.
Where's the link?
Right below.
Right below. And also, guess what? You just click it.
Just click it.